Your financial needs aren't independent of each other, so your financial advisors shouldn't be either. At Mercantile Bank, our experienced United Wealth professionals are united to serve you and your complete financial planning and wealth management needs. Are you just starting your investment journey or need to roll over a retirement plan? Do you need to plan for a loved one with special needs or for your own life after work? Maybe your business needs a succession plan or you want to enhance your employee benefit programs. Whatever steps you need to take, our United Wealth experts are ready to take them with you. Together, we are united.
Hi, this is Ron Kinscherf with Muddy River News. Welcome to Business Spotlight, brought to you by Mercantile Bank and Rober and Phillips, attorneys at law. We have Rochell Sharpe from Blessing Hospital with us. She is a psychiatric nurse practitioner, and this is National Alzheimer's Awareness Month. And you have a lot of experience working with those type of patients, do you not?
Approximately 30 years.
30 years, wow. What is Alzheimer's? Down and dirty, what is Alzheimer's?
It is a degradation of the mental capacity to take care of yourself. So someone with Alzheimer's can remember what happened 40 years ago, but they can't remember what they had for lunch.
Do they know what causes it yet?
No.
Okay, so don't know what causes it. Is it a form of dementia, or is dementia Alzheimer's, or what's the relationship there?
They're kind of interchangeable. Alzheimer's, dementia care, Alzheimer's. Alzheimer's tends to be more insidious as you just tend to be more forgetful. And then eventually you continue to decline, and that's when they diagnose you with dementia.
Okay.
So mild cognitive impairment, major cognitive impairment, etc.
So is Alzheimer's a form of dementia then?
Yes, it is.
Okay. Are there tests you can take to determine whether you have Alzheimer's / dementia?
Typically in my practice, I do a SLUMS assessment.
A what?
A SLUMS assessment.
Is that an acronym for something?
It's a mini mental
Okay.
exam. Takes about 5 minutes in the office.
That's it? Okay.
Yeah. It has numerous questions, and it will show you like major cognitive impairment, mild cognitive impairment, etc. And then you can also have, through neurology, you can have like an MRI,
Okay.
EEGs, etc.
Okay, so you can determine so when you evaluate a patient, can you tell it's Alzheimer's or another form of dementia? Or
No.
is all dementia the same thing, basically, in your findings?
It's all about the same thing. The behavior's the same. The difference or the diagnosis and treatment is the same. However, the way to get it is different. So you have vascular dementia, Lewy body dementia, Alzheimer's dementia.
Okay, can you go through those?
So Alzheimer's dementia is a slower, more old age dementia.
Okay.
There's also an early onset dementia, or Alzheimer's, which happens to people usually under the age of 60.
Okay.
Lewy body dementia has more behaviors and hallucinations.
Okay.
So kind of related to Parkinson's. They have a lot of the symptoms of Parkinson's. The difference is that when you have a start of Parkinson's, you have the tremors, et cetera, but you don't have the hallucinations. Lewy body dementia, you have a lot more behaviors, and it's more difficult to treat.
Is there anything I can do, I'm in my early 60s, to help mitigate getting dementia?
There are numerous things you can do.
And how do we know they work? I mean, has there been case studies and stuff like this?
There has been.
I guess that's part of the research that's been
Yes.
going on, yeah.
Through the National Institute of Mental Health, as well as the Alzheimer's .org.
Okay.
They have a lot of testing, a lot of evaluations and evidence-based practice that show that by increasing your exercise, losing weight, drinking less than 12 drinks of alcohol per week, actually improves your chances of not getting dementia. Hard of hearing, people that wear hearing aids, et cetera, and correct their hearing, that reduces your risk of getting dementia by 90%.
Really? Okay. Anything else? So basically, healthy living helps prevent. It's just
Yeah.
like any other disease.
Yes.
Healthy living helps prevent that.
Yes.
Is any of it genetic, or do we have research that goes back that far?
Early onset tends to be a little more genetic. You see a lot of that in families. So there's a lot of concern for your younger people when they see that mom or grandma or somebody got it before the age of 60. Is there a component? Can they 100% correlate that? No, they cannot. There is a risk. There's always a risk.
So how long has Alzheimer's, quote unquote, been a known disease?
Since the beginning of time. Before
I understand that part, but
30s,
so is that when they knew there was something going on that was determined to be dementia and Alzheimer's? And is that when they started doing some research to find out ways to deal with this? Or were those people just put in the mental institutions at that point?
Yeah.
Okay, was there a time frame when that attitude towards those type of patients changed and more treatment, so to speak, was used to deal with those type of people?
I feel like in the 1960s,
Okay.
70s, there was more awareness of it. Before, they would put you in a sanatorium.
Mm-hmm.
However, they also put you in a sanatorium if you were upset, angry, agitated, husband was mad, wife was mad, whatever, they
Right.
would put you in a sanatorium.
Right.
So how much was appropriate, how much was not?
So how are the strides coming and able to treat this disease?
There are numerous medications that control the behaviors of that, but it cannot improve or progress. So a lot of your medications can not stop the disease, but they can control some symptoms. They can decrease the risk for progression of the disease. They're not going to correct the problem.
Yeah, they're not going to cure the disease,
No.
but so they slow the progression, but the progression is still going to be there then.
Yes.
So is it basically just delaying something that's going to be happening down the road, but just try to improve their quality of
Yes.
life until that point?
Correct.
Now, is the medication easy to get? We hear all the, talks about how insurance won't cover certain things, blah, 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 blah. Is that a problem with the Alzheimer's medication?
Some of your newer medications, your insurance coverage is more difficult to get, but
Mm-hmm.
we can do prior authorizations and establish a rationale for using that type of medication. A lot of times a patient might have failed 2 medications, so now we can go to the 3rd line.
Mm-hmm.
Your donepezil, your other medications like that, they're fairly reasonable. They're easy to get. A doctor can prescribe those.
Okay.
You
So
know.
Medicaid, Medicare, that type
Yeah,
of thing will take
Medicare,
care of you.
Medicaid, private
So
insurance, et cetera.
what's interesting about you is you have a psychiatric background and you're treating patients with dementia and stuff like that. So how was it developed that I understand you're a nurse practitioner, but a nurse practitioner with a psychiatric side of things, how do you help patients with that type of background?
So for myself, I go to the Illinois Veterans Home.
Mhm.
I see patients, I do an intake and evaluation, and then I manage their medications. In my outpatient clinic, I do a lot towards education,
Mm-hmm.
healthy lifestyles, prevention of certain illnesses, such as I do my lab panels. Once a year, I do EKG. I educate on cessation of alcohol or drugs, smoking cessation, increasing your activity, increasing your care of your diet, things like that. If you're diabetic, maintaining your diabetes, maintaining and functioning.
So those two go hand in hand, diabetes and dementia? So there is a link between those two?
There is.
Is there a link between dementia and any other diseases?
Not necessarily
necessarily,
that
okay.
as much as hypertension.
Oh, great.
So,
Okay.
you've got hypertension, you've got cardiac disease, you've got dementia, you've got alcohol abuse, drug abuse. Those things can impact. Vascular dementia is related to hypertension.
Mm-hmm.
So for someone who will come in and they have vascular dementia versus regular dementia, you can look and see if they have a history of hypertension,
Mm-hmm.
hyperlipidemia, things like that.
In your role as a psychiatric nurse practitioner, how much of what you do is counseling the patient?
About 50%.
Is it? So what are you trying to do for those people? I mean, obviously they have to know what's coming up.
Right. And, the biggest thing is, we talked earlier, you could lead someone to water, you can't make them drink. So
Right.
it's educating them and helping them to understand their changes in lifestyles. And it doesn't have to be big steps, it can be little steps.
Mm-hmm.
It could be not eating the extra cheeseburger and choosing to have something else that's a little lower calorie, the chicken nuggets, for instance.
Mm-hmm.
Or changing and just parking farther away in the parking lot and taking the extra steps to get there. Increasing your exercise. You don't have to go run 5 miles
Mm-hmm.
to do something, to accomplish something. Maintaining your medications, making sure you're taking your medications correctly. If you have a hard of hearing or difficulty with hearing or tuning out sounds, socialization is a big thing. Doing your puzzles, using your cognitive abilities to stay on task. Someone who tends to be hard of hearing doesn't talk as much to people. So they sit around and they listen, they nod their head, but they're only getting about half of what you're
Right.
saying. So they're really not stimulating that brain as much as they should.
Are there things that I should be aware of or people should be aware of that if they start occurring, it's time to go see someone like you?
When they start having some forgetfulness.
But how do you,
Oh, yeah.
how do you determine forgetfulness from forgetfulness?
So someone who comes in and they're cooking supper and they leave the stove on.
Okay, that drastic of forget.
Yes.
That's okay. It's not just forgetting where you parked your car at a grocery store.
Correct.
Okay.
Going to Dollar General, they get to Dollar General and they forgot and it's not just making my list and forgot. I forgot how to get there. I forgot how to get home.
Okay. And then if I notice somebody going through all that, is there a way to intervene that you would suggest? Because that's got to be a hard discussion to have with somebody. It's like, you really showing sign. What do I do here?
I think a lot of people, when they get to that point, they pretty well know there's a problem.
Okay.
So when they come in, it's usually depression or anxiety because they're scared. They're confused as to why they're forgetting things, why they're not completing their tasks, why they're missing appointments, not paying their bills, forgetting to pay the water bill, the water gets turned off, forgetting the stove, forgetting to put things in the microwave or how to run the microwave.
Okay. Are you available to go to groups and talk?
Yeah.
All right, because I'm assuming that's part of what you want to do is the educational aspect of that. So how would people get a hold of you?
They can call our office and then set up a time. They would work with our office manager. Her name is Melinda Adair.
At Blessing?
At Blessing.
Okay, so Melinda
Blessing
Adair at
Hospital.
Blessing Hospital, 223-8400, if I remember the
Yes.
number, or they can look up Rochell Sharpe on the interweb or internet,
Right.
on the website. Okay, well, thanks for coming in.
Yeah.
All right, this has been Rochell Sharpe with Muddy River News. I'm Ron Kinscherf. This has been the Business Spotlight, brought to you by Mercantile Bank and Rober and Phillips, attorneys at law.
Your financial needs aren't independent of each other, so your financial advisors shouldn't be either. At Mercantile Bank, our experienced United Wealth professionals are united to serve you and your complete financial planning and wealth management needs. Are you just starting your investment journey or need to roll over a retirement plan? Do you need to plan for a loved one with special needs or for your own life after work? Maybe your business needs a succession plan or you want to enhance your employee benefit programs. Whatever steps you need to take, our United Wealth experts are ready to take them with you. Together, we are united.